Welcome to A Call to Action, a series presented by Great Eastern Radio and Brattleboro Community Television. We're covering many different topics from the stimulus bill to mental health. Today, we're talking with Dr. Kathleen McGraw, Chief Medical Officer at Brattleboro Memorial Hospital, and we're talking about local efforts to combat coronavirus. Welcome, Dr. McGraw.
Thank you very much. Glad to be here.
How are you doing?
I'm doing okay.
All right.
A lot of work going on, but I'm doing all right.
There really is. Well, let's get right into it. You and I, of course, are immersed in information around coronavirus. Safe to say that everyone is washing their hands with soap for 20 seconds. That's the standard. That's the first thing that came out. But what are some of the other precautions that BMH and maybe other hospitals are putting out there that are maybe lesser known?
I don't know if they're lesser known, but they're certainly really an incredible need to practice, which is number one, the social distancing. The idea of 6 feet at least between people is really, really important. And the reason for that is if you cough or sneeze or even just breathe hard, any of the droplets in the moisture of your breath are not going to go beyond that 6 feet. And so having a 6-foot perimeter around every single person is incredibly important to prevent spread of the disease.
Okay, yeah, that's 6 feet is that is still the standard, despite what people might be seeing.
Yeah, oh yeah, absolutely. If you hold your hand out in front of you and the person you're talking to holds their hand out in front of them and they can touch, you're too close together. Okay. So that's really key. And of course, there are other things like wiping down and washing high contact surfaces, your doorknobs, your tables, washing your phones. Our phones are incredible. We hold our phones, we touch our faces with our phones all the time, and those need to be wiped down regularly as well. Folks have talked a lot about not touching our face. It's kind of a funny thing. Who knew we touched our face so often? But we really do, and we must stop right now.
Yeah, so that's very important. On the phone thing, I had reached out to Patrick Brown from Brown Computer Solutions and asked him, because there's a lot of myths that people feel like they can't wash their phones, and he put out a very good informational video on how to actually disinfect your phone. Now, this is obviously something that you and I know the answer to, but I'm going to ask it anyway because I just want one more medical professional out there clearing the air around this. There have been some confirmed cases in Brattleboro. So the question is, who is likely to get the disease, and how does the virus discriminate?
The virus doesn't discriminate really at all. Everybody is likely to get it if they come in contact with somebody who has it. And you may or may not be aware that you're shedding virus. And again, that gets back to the 6 feet distance between people to really avoid any spread, because it will spread between family members. It doesn't matter what kind of a job you have, where you live, who your friends and neighbors are. It makes no difference.
Okay. All right, so that I just wanted one more voice weighing in on that it's you can't hit what you can't see. So
right, exactly.
And that's the message I've really been trying to take home, because we've been taking this very seriously. Speaking to the hospital, what happens to the infrastructure of the hospital if we don't effectively flatten the curve soon?
So that's an excellent question, and one that we've been preparing for quite some time. We've been effectively retooling our hospital to turn it into a hospital that is prepared to manage a very large number of patients with infectious respiratory disease. We've focused on changing to have outpatient clinics that are focused on acute care for respiratory patients, as well as non-respiratory patients seen in different facilities. And there's some information about that'll be forthcoming for patients to help understand that. But also really putting together a surge space within our hospital that will take care of these very sick respiratory patients. So it's been, as I said, a whole retooling of our facility, and actually of our med staff as well, and our clinical staff, as we've been studying up and learning what do we need to know, what are the materials we need, medications we need, what are the supplies we need to be able to deliver this kind of care. We've been working very closely with partners locally and across the state, and a little bit nationally as well, to make sure that we are putting the right pieces in place and working really as a team as well.
Well, it sounds like, if I can just ask a B to that kind of question, it sounds like you've been sort of, I mean, to retool takes some time. So how long have you actually had this on your radar?
Oh, it's been quite some time. I mean, we've been doing pandemic preparation back since H1N1 many years ago. So we took that out and started dusting that off months ago at this point. And you know, when we saw that happening in China in January, we started to look at it for ourselves. Obviously, we've been springing into action much more dramatically in the past couple of weeks, but this has been something that we've been moving toward for a while.
Okay, it's good to know. It's really,
Yeah.
it's honestly, it's comforting to know that we have professionals right within Windham County who are that attuned to what's going on on a world stage. So thank you for that. All right. So when we are, again, we're talking about flattening the curve. You mentioned respiratory things. Ventilators have been in the news a ton lately. And how big of a concern is getting a ventilator here, maybe in Brattleboro or in Windham County? And then, if you can, touch upon it maybe on what that looks like statewide.
Sure. So ventilators are a tool. People often refer to them as breathing machines, and they're a tool that are used for critical care. We have them here at our hospital, as do most hospitals. There are also other types of respiratory therapy, breathing assistants that are not ventilators that we can use and modify as well. So we have some here. But we are also working with our regional partners to ensure that we can get access for our patients to additional critical care resources as need be. You know, across the nation, there are not enough ventilators. That is, in point of fact, true. It's a very difficult thing. There are not enough ICU beds across the nation. And that really gets back to the really important part of what I think the message these days is, which is about stay home, social distance. It's what we need. Because if you have, I talked to the firefighters recently and I said, you know, as an example, I said, is if you have 100 calls for house fires and they come over 100 days, you can handle that. That's not a problem. But if you have 100 calls for house fires in one day, you can't do it.
Right.
And so that's really the key. We have equipment that we need to be able to treat this disease, but it's about flattening the curve to ensure that we can do that successfully.
So let me ask one question. So if somebody is comes down with COVID-19, with the coronavirus, you then you determine that, and there are certain cases that are bad enough that where the hospitalization is necessary, and
Correct.
then there are certain cases where hospitalization is not necessary.
Right.
And do you? I don't know if you have any statistics, and this is literally a question I'm forming on the fly here. Is there a statistical, like it's 50% need hospitalization, 50% don't, or is there a number?
So we don't have good data in the U.S. yet because this
Okay.
is still new for the U.S. Data that we've seen internationally says that 80% of the people who get COVID will have mild symptoms. And it'll be the other 20% who will have more severe symptoms, not necessarily all of them needing hospitalization, but more severe symptoms. So 80% will feel like they have a really rotten flu. 20% need more attention than that.
Okay. Very good. Let's do this. When people begin to mobilize, especially in our community, they feel strongly they want to help. What
Mhm.
are some of the support efforts that people in our area can do for Brattleboro Memorial Hospital during this time? And B to that, and which is sometimes more important than the original question, what do you want them not to do?
Sure. So one of the things that you can do is, and this gets to when you asked me about ventilators, there are other supplies that we actually could use some. We've been getting some requests about, do we need assistance with any supplies? And two things that we do need and we would welcome are dust masks. There are a number of patterns out there on the web, and we are certainly taking donations for those. You know, the simple cloth surgical mask or dust mask would be great. We're using them. And the other thing is gowns. So those two things we're accepting donations of, we would like. The other thing that aside from, again, going back to the social distancing importance that we would like, we also know that the community, to be able to support the stay-at-home model that the governor has asked us to do, and which we fully support, we need people to support each other in their ability to do that. It is very difficult to do that, and we need everybody to support each other so that we don't break down and end up, throwing COVID parties where people are gathering together again, because that will just accelerate the disease. So that is really key. The other thing is that be in touch with your primary care about what your symptoms are. If you have symptoms that you would not normally go to the emergency room for, you still don't need to come to the emergency room. You need to call your primary care, and maybe even be seen by your primary care, not just a phone visit. Because we want to save our emergency care to make sure that it's available for people who have true emergency care, because that's what we're here for, is to provide that. So what we do ask is that folks reach out to their primary care to help them decide to come to the hospital. Now, obviously, if people are having chest pains or short of breath or anything like that, of course, we want them to come to the emergency department, by all means. But really encouraging people to be in touch with their primary care.
Right. And to be clear, and just to put a finer point on what you just said, you're not saying that if you feel like you need emergency care, not to come.
Oh, heavens, no, we want you right here.
Right.
Please, please, please come. Absolutely. But if you normally have a flu or a touch of a temperature, that's not something people generally go to the emergency room for, and you don't need to in this case either.
Okay, good to know. All right, a little confusion around what asymptomatic means. All right,
Sure.
so can you shed some light on that, because this is really sort of the dangerous time for the coronavirus.
Right. So asymptomatic means without symptoms, and this is the part that's very difficult, and this is why the social distancing is so important, because when you have a cough, I think everybody knows you're supposed to cover your cough with your elbow, and it helps you prevent spread, and a cough is a symptom. If you have a fever, you have a symptom. Asymptomatic is when you don't have a cough and you don't have a fever, and the reality is you actually are already infected. You don't have any symptoms, but in fact, you can still be contagious. And so that's what we're trying to prevent, is contagion by people who don't realize they actually already have infection because they don't have any symptoms.
And how long can a person be asymptomatic for?
I don't think we have a good understanding of that. We do know that the reason we use the 14 days set of isolation, I think folks have probably heard a little bit about that, is that it does seem that if somebody has a solid exposure, a documented exposure to somebody with COVID, that if they don't start showing symptoms in 14 days, they don't have it.
Okay. All right. So 14 days is the benchmark.
Right.
Just so we can establish that. Now, obviously, we live in a pretty polarized world these days. Strong opinions levied, lines drawn. Coronavirus seems to be no different, unfortunately. Hopefully, science is still a thing and it still means something. So if you would explain to our listeners and our viewers the difference between COVID-19 and, say, the flu that blew through here last year.
Sure. So flu is a known virus. It mutates a little bit every year, but we know that it's around. It's been around for a very long time. We know enough about it that we can make a vaccine that is, pretty good in preventing a lot of cases of flu each year. The thing about the coronavirus is it's brand new. It's never existed in humans before essentially January of this year. As folks know, it started internationally, and we live in a very global world, and it has spread everywhere, obviously. It is very contagious, more contagious than some other viruses, in part because of the asymptomatic spread. And it's also a pretty severe disease. Nobody has any immunity to it because it hasn't been around before. So it's very different than the flu in that way. The other way in which it's different than the flu is the flu really dies down in the summer. I think we don't know whether that's going to be the case for this. And so we're kind of waiting to see what that's going to look like.
So one of the things that I have read, and I'm constantly scanning social media and looking for news and information on this. is that even if this flu follows in line with the flu that we had last year and does die, that doesn't not necessarily mean it goes away, that it could spike again in the fall. Is that correct information?
That is correct, possibly. But there's a lot to know about this because it's very difficult to predict what it's going to do next fall when it hasn't even been around for a year.
Right.
So we don't know. I think what we do know is that we need to anticipate that possibility.
Okay. Again, I will throw in a disclaimer for Dr. McGraw and just saying that because there's just so much developing information that some of my questioning is unfair. I apologize. They're just questions that I have in the moment, and I think others do as well.
Yeah, I think everybody has a lot of questions about this, and scientists are working very, very hard, looking at can they develop a vaccine. There's nothing yet. A vaccine generally takes a couple of years to develop, so the folks are scrambling really fast to try to create one now. We'll see what comes of that. It's just brand new, and so everything is still very much in the works.
So speaking to that, have you seen anything in the short term that might give you some hope that that we'll be moving out of this anytime soon, or are we really just in kind of a holding pattern?
We're not in a holding pattern, and it's not moving on anytime soon. We are in the early stages of the throes of it going through the U.S. We know that New York City is one of the early areas. You can see the spike in the number of cases there. We know Vermont has had a spike in the number of cases. Every day those number of cases are larger. I don't know what they are today, but if you go to the Department of Health website, they post every day what their total number of cases are. So we're in the early stages of this, and we'll continue to be in this, I imagine, for weeks to come.
All right. Thank you. Dr. Kathleen McGraw, the Chief Medical Officer at Brattleboro Memorial Hospital. There will be a link in the video for this that will take them directly to BMH's website so that they can look up more information about COVID-19. Thank you for jumping on a call to action today with me. I really appreciate the information and you taking the time to do that.
Sure. Happy to be here. Thank you.
Thank you.